We now move on to item number 6, public comment, which is the opportunity for anyone to speak about anything not on today's agenda, but does come under the purview of the Santa Clara County Board of Supervisors. With that, I'll ask people to continue registering. And Colin, let's go with 1 minute each, please.
All right, first speaker is Mike Rogers. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Oh, 1 minute here. There we go.
Good morning. Thank you for your time today. I just wanted to make a public announcement for the board and county staff and the public about a very special speaker we have tomorrow evening at the Health Advisory Commission. We're very honored to have the Honorable Dr. Robert Lustig, Professor Emeritus, UC Berkeley. He's Professor Emeritus of Pediatrics and Division of Endocrinology and a member of the Institute for Health Policy Studies at UCSF. Dr. Lustig is honoring us with this time to give a talk on ultra-processed food. And he is, he is an honorable, eminent speaker, keynote speaker at many metabolic and health conferences and nutrition conferences around the world. So just wanted to make that a public announcement. Thank you for your time and attention.
Thank you, Mike.
All right, the next speaker is B. Beekman. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, Blair Beekman here. It's been a while since I've been at public comment time. Thank you. To try my best to comment on the items of public genocide and the concepts of how we describe history. When we're going through a time of war, there's an important battle for public opinion that really it lacks clarity in how to better talk about and understand issues. Good luck how we can do that now. With time and history, we're able to better label and name situations. I hope all sides in the Ukraine can get a break and we can treat this idea fairly and talk about it honestly and really, really work towards ideas of peace and not war. With 14 seconds, a quick reminder that with so many new subsidy programs available at the state level, good luck how we can make the conversations of subsidy more open to everyone. Thank you.
Thank you.
The next speaker is Nadia. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. And Nadia, go ahead.
Hi, good morning, Board of Supervisors. Can you hear me?
Yes, go ahead.
Hi, my name is Nadia. I am one of the many employees that Santa Clara County has on unpaid leave. I am calling to ask all of you to please step up against the discrimination that is going on in Santa Clara County. Mr. Smith is not doing anything to accommodate us like he has stated in the past meetings. Not sure how is that Mr. Smith is allowed to continue to discriminate all of us just based on our religious beliefs. Every time he calls in, he says that he's looking into it and that something's going to be printed, and at the end of the day, nothing gets resolved. So I am calling again to ask all of you to please step in regards to this matter, because all of us are still not working. We're being very affected. We are ready to go back and serve our community, so please do something about it. Thank you.
Next speaker is Christina Lopez. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, good morning, Board of Supervisors. My name is Christina Lopez. Please align with California State Public Health Orders. Please investigate the risk tier system that's discriminating against employees from returning to work. It's not fair to only pick and choose who can work and who can't. Hospitalization is down right now in San Jose. San Jose mayor ended the booster mandate for San Jose city workers, but they're still enforcing it for county workers. We all live in San Jose, work in San Jose. We shop at the same stores. Our children go to the same schools. I don't think it's fair. We should all be treated equally. Please investigate the risk tier system. Please stop the discrimination.
Our next speaker is Ken Horowitz. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good morning.
Good morning.
My name is Dr. Ken Horowitz, Health Advisory Commission, I want to follow up on Commissioner Rogers. Our meeting is tomorrow evening. You can go to the meetings portal for Santa Clara County at sccgov.1qm2.com and learn about the Health Advisory Commission. The Commission is going to also be talking about functional medicine. We believe as a commission that to close the equity gap in Santa Clara County, there is an additional approach that needs to be addressed. And Commissioner Rogers will give a presentation on functional medicine. And along with Dr. Lustig, who will be talking earlier on food as medicine. So again, go to the meeting portal for the Health Advisory Commission starting at 6:30 this evening. Wednesday evening. Thank you.
Next speaker is Delilah Pulido. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
There was no interactive process for these workers. There was no reasonable accommodation. And if you think putting workers on unpaid leave is a reasonable accommodation, then something is seriously wrong with you and you don't understand the law. Third, ESI and EOD made it perfectly clear there would be no transfer and no reassignment into another position. Instead, you left these workers scrambling for help and there was no help to be found. These workers worked through the entire pandemic, keeping the county services from collapsing. And now that we're in an endemic, you want to get rid of them. This whole situation has exposed the corruption going on in the county. You don't care about your workers. You just care about money, power, and control. Jeff Smith has mentioned that department heads and managers were involved in the decision making, and we know they signed the religious exemption documents. Every single person that was involved in creating a policy and signed off on the documents that discriminated should face court for crimes against humanity and civil rights violations. The county is persecuting and violating workers' religious rights. The county wants us to violate our religious beliefs and convictions in order to keep our livelihoods.
Next speaker is Larry Alba. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, I'm Larry Alba, and I have been researching tax bill redesign ideas for 5 years. I have seen and heard many suggestions from the grand jury, school teachers, and many homeowners. I understand that the supervisors approved item 47, the tax bill redesign requested by the grand jury. And I have similar ideas to make the tax bills more transparent, easy to read, and understandable. I actually need about 3 minutes to read my letter that I've given to the supervisors, but part of it is the detail and taxes section, and then I've got ideas in there about how to show homeowners about their exemptions available, and also that the tax bills should be larger. I hope they will call me and invite me for future help on this.
Next speaker is Alex L. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Thank you so much for this opportunity. As a vaccinated county resident and employee, and also as an SEIU steward, I want to echo the concerns lifted up by those who are on unpaid or other types of leave due to the vaccine mandates. You'll note that I started with my vaccination status. This is because there is a privileged status associated with it, meaning there's a corresponding discriminatory status for those who are not vaccinated. My firsthand experience in representing my colleagues from at least 4 different county departments has made it very clear that the accommodation and interactive process is in name and paper only. I ask that, how is it healthy for the community for those employees on unpaid leave to lose their health insurance? And I asked that in a meeting with one of the Board of Supervisors staff in the fall and don't have an answer yet.
Next speaker is Bren Perez. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, thank you for the opportunity to speak. My name is Brenda Perez. I work for the Santa Clara County Sheriffs and the Custody Bureau. I'm a sergeant there. I've been with the county for 16 years. And I am considered a high risk, have not been accommodated, have not had no process to be accommodated. And I'm currently on unpaid leave, pending termination according to my letters. So, same as anyone else, like we just want answers. And, you know, what I'm requesting is that you follow up on any of these updates that Jeff Smith has been asked and there has been no answers. I would like to request the specifics as to how being unvaccinated, I'm more of a risk of those who are vaccinated based on studies and research, not just opinion. And I would like to request the source for all those studies that Jeff Smith's referenced. The jail is very short in staff. They were short when I was there. And he said he would submit a waiver if we were struggling. Deputies are being mandatory twice a pay period. That means they have to work 7, 12-hour shifts. That's how mistakes happen because people are tired, exhausted. They don't get enough time to spend with their families and care for themselves. We've been on mandatory for years. Thank you.
Next speaker is Teresa. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Can you hear me?
Yes, go ahead.
Yes.
Thank you so much. I'm calling because my husband is a roofer and he was put on unpaid leave. They did not, actually they approved his religious exemption. And then when the tier system came out, they put him as high risk, even though he's outside as a roofer. And I am disheartened by that because my husband interviewed on the day that he buried his brother. He went to his interview for the Santa Clara County because this job was so important to him. And he has been on call at the beck and call of whatever was needed. He would go in and do whatever was needed to be done. I also want to talk about being in violation of the California Health and Safety Code 24171, which states the legislator hereby finds and declares medical experiments on human subjects may be beneficial. However, such experiment in respects to oppressions of human life is at the individual's.
The next speaker is Rhoda Fry. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
I have concerns about the 2 quarries in District 5. Stevens Creek Quarry has been operating with land use authority for 7 years now, and with its conditional use permit having expired in 2015. To avoid being out of compliance with the state, the county created a stipulated order to comply with milestones that are now overdue. The use permit does not allow queuing of trucks, yet this is happening and is a public nuisance. County reports show that quarry walls have been overmined, and given the truck traffic, I am worried of the possibility of overmining both vertically and horizontally. Lehigh has been idle for over 2 years. Reclamation is overdue. The landslide above Permanente Creek is a safety hazard to downstream homes. They are exporting rock that likely breaks the approved 2012 promise to stabilize our crumbling protected ridgeline. I am begging you to please regulate these quarries. Finally, a huge thank you for Supervisor Lee's referral on item 17, which has at least a dozen letters of support. Thank you.
The next speaker is Lori. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, and thank you for this opportunity to speak. My name is Lori, and I am a nurse at Valley Medical. In 2016, I was hired by the county, a dream employer. Since exercising my religious conscience to not get vaccinated, my 2016 dream employer, the County of Santa Clara, has become a daily nightmare that I am currently living wide awake. I was forced and not allowed to work at my county job. I have been denied a self-initiated reasonable accommodation on my unit and denied any efforts or interactive process to obtain an accommodation. I have done nothing wrong. The high risk unvaccinated are not a significant health and safety risk like Dr. Cody and Jeff Smith claim. Omicron did not and does not distinguish between vaccinated and unvaccinated. Asymptomatic COVID positive vaccinated healthcare workers were allowed to work in hospitals, but yet unvaccinated COVID negative workers were not. We should be able to return to our jobs. I have done nothing wrong. Thank you.
The next speaker is Brenda Ferris. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, can you hear me?
Yeah, go ahead.
Hi, yes, I'm a nurse in the ER at Valley Medical Center. I am vaccinated, and I'm calling to speak on behalf of my fellow coworkers who are all vaccinated. We would desperately like to have our fellow unvaccinated staff back to work. I want to speak to the fact that we have been working short-staffed. On a previous meeting, Jeff Smith said that the nurses are not short-staffed. However, in real time, we are. I worked the last 4 shifts, at least 5 to 6 nurses short, 12-hour days, extremely long and difficult. We would like our coworkers to come back to work to please assist and help our patient populations. Thank you.
Next speaker is Rosie Moreno. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Go ahead, Rosie.
Okay, can you hear me?
Yes.
Okay. I want to thank Supervisors Ellenberg and Chavez, whom have been the ones advocating for those of us on unpaid admin leave as of 11/1/21, for questioning the county on the risk tier system, which, by the way, nearly 6 months later, we still do not have a clear understanding or definition of the parameters, and the continued request as to why the county refuses to align with California state health orders. Where's the evidence the county made up risk tier system works at all? Both vaccinated and unvaccinated individuals can pass COVID on to others. Across the nation, mask mandates are being eliminated, both through the court systems as well as through public and private organizations. Yet the county has posted in all county buildings that masks are required regardless of vaccination status. Contradictory information yet again. The county's COVID fear-mongering agenda no longer works for the community we serve. The county does not want to die on this hill. Please use your taxpayer dollars on more important business matters rather than spending them on bullying those who oppose your.
Next speaker is Carlos Padilla. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Yes, thank you for taking my call. Can you hear me?
Yeah, go ahead.
Okay, thanks for taking my call. I called before. I'm just echoing everyone's concern about our rights being violated. I'm put on administrative leave without pay. I've been with the county for 24 years, 10 years part-time, 14 years full-time, working at the Boys Ranch and starting their sports program, doing a lot of things that, that is stepping up as a counselor to really try to impact these young people. And then to be treated like this, even after the 18 months we worked the COVID schedule, tested twice a week, wore a mask, and then just all of a sudden in 10 days be put on unpaid administrative leave, I think is wrong and violates our rights. So I'm hoping that the Board of Supervisors will do something about this. And I just can't believe this is happening in America. Thank you.
Next speaker is Danette. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. And Danette, are you there?
Yes, sorry, couldn't find the unmute. Thank you. Yeah, I've read the information that was posted by Jeff Smith on the tier and risk criteria. And I think what's challenging in my head is that they speak as though the criteria were always there, that this tier system is just how we do things. It's what has always been there, but it isn't. It's something that they made up. And then we're basing our lives and our careers off of this very wobbly, built on sand criteria that is falling apart. So I'm asking if you could, again, review the fundamentals and why this tier system was even made up out of the blue, and then we're basing our lives on it. The other thing that I wanted to ask is that in also what he wrote, he uses the same verbiage that's been used since, I don't know, back in the summer, clinical trials, scientific research.
The next speaker is Emmett Mummy. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Good morning.
Good morning.
There are county departments such as county hospitals currently employing the unvaccinated. I work for the FAF department as a carpenter. I periodically get work orders in high-risk areas. I do not clock into one or work in one on a daily basis. However, FAF department employees may not enter a county hospital unvaccinated at this time, unless off the clock. When the term unvaccinated comes up, our department has no leniency, even with opportunities for us to work outside literally and in many cases away from high-risk areas. We have never been given opportunities such as alternate start times or locations to limit exposure. FAF tradesmen and women perform job duties isolated from all county personnel and community members for safety, regardless of COVID. Community members no longer have to prove their vaccine status to enter a shared airspace. Why do we? If one person in the building is unvaccinated, we all should be able to enter vaccinated.
The next speaker is Meg D. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello?
Yes, go ahead.
Hi, my name is Megan. I have been a Bay Area resident my entire life. I have worked for the county over 12 years, and as of November 1st, I was placed on unpaid admin leave. I find this to be quite discriminatory, especially since the fact that I have had COVID and recovered from it, but apparently Jeff Smith refuses to look at the science of the over 150 studies showing natural immunity as being just as sufficient as vaccinated. I have put my time and effort into this company. I have lost my income, my benefits, and I will eventually lose my pension if I am terminated. I have 3 kids that I am caring for, and I've had to pull them out of their private schools. I have had to sell my house. I am just asking for the Board of Supervisors to look at the actual science of everything and not just the narrative that is being pushed. Please.
The next speaker is Greg. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Greg. I work in the ER at Valley Medical Center for over 17 years now. I am vaccinated, and I would like to voice my support for the unvaccinated. Please allow them to work. We are being inundated with sick calls, and we do not have enough staff to work. And we need our unvaccinated employees to come back and help us take care of the community. I would also like to point out the inconsistency in what Jeff Smith said last week in the last meeting when he said that masks only protect those who are wearing them. Unvaccinated people who are tested do not have COVID, and we are vaccinated. I still got COVID. I can still spread it. It is ridiculous that these people aren't allowed to work. Please bring them back to work. We need their help. Thank you.
The next speaker is Christina. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hello.
Hello.
Yes, go ahead.
Hi, good morning, everyone. My name's Christina. I work in the VMC ER for over 10 years, or at VMC for over 10 years. And I just want to point out when Supervisor Wasserman asked Jeff Smith if a COVID positive staff member wears gloves and PPE, could that person still transmit COVID? And Jeff Smith said yes. So I'd like to point out that there was a written policy that was actually released during the surge that actually allowed vaccinated staff that were positive with COVID to return back to work. And it also allowed vaccinated staff who were asymptomatic but positive with COVID to return to work in the so-called high-risk units. So if Jeff Smith is saying that this tier system was meant to protect the clients, I was just wondering how it made any sense for us to allow those who were positive to continue to work in their units, but not allow the unvaccinated who were negative and testing twice a week to even return to work. It seems that the tier system is really inconsistent and doesn't make sense. And I just hope the Board of Supervisors will just consider the unfair and hypocrisy of this tier system.
The next speaker is caller ending in number 168. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi,
Go
good
ahead,
morning.
caller.
Can you hear me?
Yes, go right ahead.
Okay, great. Hi, good morning. My name is Elisa. I've been in the emergency room at VMC for 15 years. I know you've heard a lot about getting our employees back to work. And as a vaccinated employee, as well as other vaccinated colleagues, we urge you to help us. We 100% feel comfortable working around those who aren't vaccinated. There's no greater risk for their health or the patients they are caring for. We have been extremely short-staffed, and the last of our travelers are leaving in 2 weeks. Currently, there are only 5 admitted COVID patients, and in the last few weeks, there have been nearly the same amount of TB cases. We've all been trained for proper PPE in order to not contract that airborne disease. So there's no greater risk for these employees to contract or spread COVID. We need them. And let's not forget, these are the same employees put themselves and their families on the front line for the first year plus before there was even a vaccine. Let us all respect each other's personal beliefs and get them back to their home units. Thank you for your time.
The next speaker is Alyssa. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Alyssa, are you there? And there was no one there. That concludes our request to speak.
Thank you, Colin. Thank you very much. And I thank the 23 speakers that we just heard from. That concludes public comment. We now move on to item number 14, which should be Dr. Smith. Yes, it is.
Oops. Members of the board, thank you very much. At our last meeting, the board asked for an update on our county policy about vaccinations and high-risk areas, and I think we provided you in the attached documents with answers to the majority of the questions, if not all the questions that were asked. I would just go through a basic rendition of what's gone on in the beginning, middle of the pandemic. We established a vaccination protocol for our employees, so requiring all employees to be vaccinated unless they had a religious or medical exemption, in which case we attempted reasonable accommodation in other skills, other areas of work within the county. We had a very positive result, and we're, as a workforce, highly vaccinated. In December, in a separate motion, not related to our policy, there was a local health order which stated that in order for unvaccinated individuals to work in certain high-risk areas, the organization had to apply for a waiver, and the waiver would be evaluated in terms of safety. That public health order was amended in early March, at which point the requirement for an exemption for the organization was lifted, and still recommended that vaccinations be required but not mandated. When that order was lifted, the county reverted back to its previous policy, which requires employees to be vaccinated based on a risk stratification system, high risk, low risk, medium risk. You've got that explained in the packet that you have with you. We have had people who have applied, employees who have applied for exemptions because of religious and medical issues, and the result of that is that they are considered for reasonable accommodation. Now, you've heard from the public and some of the employees that that has been challenging. I agree, we should be doing better with reasonable accommodation. But as is pointed out in the documentation, there are now 138 employees out of 22,000 who are on paid leave related to the policy. You can see that most of them are related to patient care contact or contact with custody clients. And we're working to encourage them to get vaccinated or to find other reasonable accommodation, which I said we will re-up our efforts on. With that, I think I'll just take questions.
Thank you, Dr. Smith, for that presentation. I don't have any hands raised, I'll start myself. Dr. Smith, and I know it's all your discretion, but I certainly am in favor. This goes to Dr. Cody as well, of the county following the state rules as soon as possible without any modifications of any kind. I think Supervisor Chavez brought that up earlier. It's tough for people to understand. I love saying, we don't have any rules, we follow the state. And I know that's a cop out, that's a way out, that's a whatever, but that consistency. And I'm also feeling that, we can't live in fear forever. And following the state's guidance at this time would certainly be my preference for you to consider. The other one was, I've been learning different rules about cubicles with ceilings that go to the wall and don't. And I personally would be in favor of vaccinated county employees who are alone in their cubicles not needing to wear masks unless somebody comes to their cubicle, then they have to put on their mask. I learned about, offices and office doors closed and walls to the ceiling, and they get to take their masks off. But I certainly feel when I see various staff members in their cubicles alone having to wear a mask all day long because their ceiling doesn't go to the top. That's just my 2 cents. Vice President Ellenberg.
Thank you so much, President Wasserman. Dr. Smith, I appreciate hearing that there are plans to step up the process of identifying and securing reasonable accommodations for those, what's the number, 138 employees. My understanding is that ESA has created an email alias that's staffed by 3 people. And I'm told that they're just sharing basic information about available positions and that they aren't proactively seeking to place employees. My sense is that type of work would really require somebody to be working at a higher level, to be working across departments to identify appropriate alternative roles. But I realize that that's in itself a difficult task, but expected to work through the reasonable accommodation process if they don't have access or authority to move employees into alternative work environments. It's and my understanding is that it's most often the location of the work and not the function that's really in question here. So if there's more nuance to the issue that can be shared publicly, I'd be happy to hear from County Council. Before though, let me just make a couple of other observations. Unpaid leave in and of itself is not a reasonable accommodation because it doesn't provide equal benefits and privileges of employment. And our core issue here is that we need to be providing fair, legal, supportive access to reasonable accommodations for employees that have approved exemptions. So just for my own full history and to be able to answer constituents, I'd like to get the answers to a couple of questions, please. First, when was the current risk tier matrix created? A month and a year is specific enough. Dr. Smith, can you share that?
It was created right as immunizations were being introduced into the market. So that's a year ago. It's been enforced based on the same model, like you said, reasonable accommodation. And I should clarify, we do not consider unpaid leave to be reasonable accommodation. It's a waiting.
Actually, I'd like to speak to that issue in a minute when you're done.
Sure. Go ahead, Dr. Smith.
The way that we went about trying to deal with the reasonable accommodation was equivalent to what we usually do with typical reasonable accommodation processes. However, because we had so many, we did get overwhelmed. So working on expanding our intervention in the process so that with the remaining 138 employees, we can be more proactive. So hopefully that answers your two questions.
Let me hear from from James first, and then I'll come
Yes,
back.
James.
Yeah, I just wanted to clarify that from a legal perspective, providing an employee with unpaid leave is a form of reasonable accommodation. I recognize that there's a broader policy conversation about additional and reasonable accommodation measures, but I just wanted to clarify that because it is absolutely an accommodation versus discharge from employment.
Thank you. And I didn't want to suggest that we were doing something that was not compliant with the law. Certainly the spirit of the effort is to move people into reasonable accommodations, with the unpaid leave as necessary being a waypoint, essentially. And Dr. Smith, I will be interested in hearing how you're going to ramp this up. And I would like the Board of Supervisors to receive a verbal update at each future board meeting, citing the number of high-risk tier employees with exemptions that were reasonably accommodated in the preceding 2 weeks. Let me just ask a question about did you want to say something about that request first?
No, I was just going to say we'll be happy to do that.
Thank you so much. The risk tier attachment references criteria from the Public Health Department that are being applied by the departments, but I can't find any specific or objective criteria in the document. Where can those be found, please?
That refers to the recommendations of the public health officer, not the orders specifically. So we still have recommendations, strong recommendations, that individuals who aren't vaccinated not be in high-risk environments. It's just not a mandate at this point.
So
it's in the health order, but it's not an order. Maybe James can clarify for you.
James?
Yeah. In one of the attachments regarding the risk tiers and rating criteria, there's a description of the factors. The departments apply those factors to specific employees' work. And so those factors are, the person's interaction with vulnerable populations, for example, whether it's a congregate setting, the extent to which that individual has direct interaction with others. Those are the specific factors, but the department's applying them not on a classification basis, because people in the same classification sometimes are doing different work or working in different settings, but applying those to the specific work of the specific individual. Now that's more clearly defined in the case of the jail and the hospital. And as you can see from the other attachment, which includes a list of employees, that's where the vast majority of the employees who are currently on leave, arise from.
So, James, I appreciate that, and I understand that it's applied to the individual employee, but I think it's important. You just pulled out a couple of specific criteria from the order, and I think it would be very helpful in clarifying if there is one place where there is literally a list. It's not the same as saying how does it apply to each particular employee, but we should all be able to look at the same specific and objective criteria in the interest of transparency and consistency with what we are considering. I'm not looking for consistency necessarily in outcome given the different roles, but it's been very difficult for employees to even find that list.
Any comment?
I'll comment on that.
Okay.
Okay, thank you.
We'll go back and try to clarify.
Thank you.
Okay, and then finally, Dr. Smith, thank you for agreeing to provide a verbal update every 2 weeks. And I'd also like at least the first update to include what actions have been taken in order to speed this up. Did you recommend increasing the staffing, doing something else in order to make this happen faster? And I'd like to ask administration to work with our bargaining units to collaborate on identifying open positions in intermediate or low risk settings. I think we've got to work together to find roles for these employees, many of whom we refer to as frontline heroes during the pandemic. So let's really use all of the tools and try to improve the consistency and the support for employees.
Thank you. Supervisor Lee. To unmute. Perhaps your hand went down?
No, my hand went down. Many of the questions I was regarding the accommodations that we heard issues from RNP nurses. I think Supervisor Ellenberg has definitely gone over so much in much finer detail than I have. So there's no more for me to add. Thank you.
Thank you very much. That concludes the hands that I see there. I'm thinking going forward, Doctor, we want to have your comments regarding COVID, whatever they may be. Let's put them under the public health officers and administration's report that we receive in the future. Combine all that, we can be more efficient on our speakers.
Supervisor Wasserman.
Vice President Ellenberg, yes.
With apologies. We've now moved to monthly COVID reports rather than every 2 weeks. And I'd like to be sure that this information regarding the employee accommodation comes to us at every meeting. So when there's not a public health report, is there somewhere else you'd like to include it?
Okay, Dr. Smith also gives us a report along with County Council later in there too. So we could do that. And Dr. Smith, that could be part of what you report out at that time. Will that work for you, Dr. Smith?
Yes, I was going to suggest the same thing. I would prefer to do it during the county executive's report every meeting because it really is, it's related to COVID, but it's really an administrative regulation. And so it probably is best done during my report on a.
Super. So you like my idea, and I'm not an attorney or a doctor. All right.
That's pretty good.
Let's keep moving this meeting along. That was item 14.
We have a number of public speakers.
And we're turning to the public speakers for a minute each, Colin.
Next speaker is Barry Arata. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
All right. Thank you very much. I've already introduced myself, so I'll cut to the chase. We got a lot of facts to discuss here, so we appreciate everybody having open dialogue. Supervisor Ellenberg, Supervisor Chavez, for holding hard press against Dr. Sarah Cody, Jeff Smith, and James Williams to get some clarification. I heard 183 workers, and that's outlined on your paperwork that you put out today on item 14. Those workers are all on unpaid leave, not paid leave from the county, because we're all aligned together and we're working together to keep our jobs and keep this community safe. So you guys need to get your facts straight, number one. Number two, continuing to do this to us makes zero sense at all. You now have stated that it's recommended that you have an exemption to work in high risk, and you're putting it on the employers. We have 2 firefighters in the city of San Jose that didn't get boosted, and they got denied exemptions, and now they're on unpaid leave because of what you guys are doing. So get your story straight.
The next speaker is Danette. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi there. So we're aware that the definitions of the tier system have been provided, but at this point, it seems like the question needs to be more about the validity of using such a system in the first place. It doesn't make sense anymore. And I'm just wondering if we could answer this question and why it's being used. when it doesn't apply, and also recognizing that statements that are in writing, such as, quote, based on the significant COVID-19 health and safety risk to and posed by the unvaccinated employees, ... The statements are no longer valid. They're not based in reality. And yet this is the verbiage that keeps being used. Clinical trials, scientific research, and safety monitoring have demonstrated that vaccines prevent the spread and prevent illness and hospitalization and death. These are not true and they're not based in fact, yet it's what we're basing our jobs on.
The next speaker is Christy. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Yes. Hi, this is Christy Connors with Bay Area Freedom Alliance. The vaccine mandate makes no sense. This is not a sterilizing vaccine. The original vaccine, as with the original documentation that you guys have provided, was outlined in May or in the spring of 2021 based on a vaccine that was paired for the Alpha variant. That variant is long gone and hardly exists in nature and hardly exists at all anymore. We have a vaccine that is not paired to the Omicron variant, and now we're forcing that on people. It doesn't make sense. It's not sterilizing, which means you can still get COVID, you can still spread COVID. So mandates don't make any sense in this context. All you are now doing is putting people out on unpaid leave for stating their truth. And I'm sorry, County Council, Mr. Williams, I don't agree with you. A reasonable accommodation is not putting someone on unpaid leave. You're ruining their lives. Thank you.
The next speaker is Elizabeth. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. And Elizabeth, are you there? I will come back to...
Can you hear me?
Oh, there you are. Go ahead.
Sorry. You hear me now?
Yes.
My name is Betsy. I'm a nurse at O'Connor Hospital, and I thank you very much. I just wanted to say that Dr. Sarah Cody just explained to us that that the county is aligning with state orders regarding religious exemptions and vaccines. I am a nurse who has a religious exemption to the booster vax. As of March 8th, she was allowing people to go back to work with two accommodations, which were masking and testing. The county workers are being denied these accommodations that Dr. Cody just explained to us. And I'm asking, why are we being denied these accommodations and being discriminated against while the rest of the people in the county are being allowed to work just like she outlined? And I thank you very much for this.
Next speaker is Tom Davis. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
I'd like to speak for the trades. As an HVAC mechanic, I've worked for the county for 3.5 years. I was put on unpaid administrative leave when my occupation was assessed as high risk. The talk that the county has initiated the process of finding reasonable accommodations for those that are exercising their legal right to a religious exemption, I can tell you that there has been no such outreach to me or my fellow tradesmen. May I speak plainly? I'm a mechanic that works on roofs, and when I am in the building, the employees and public are always told to stay away from us as we use tools and ladders that are hazardous to be around. A carpenter and a roofer, my fellow tradesmen that were put on unpaid leave when their jobs were reassessed from the medium risk to high risk in February, both of these trades are isolated from the employees and the public of the county. So the question begs an answer. How were we ever put into a high-risk tier is beyond me. We literally have little to no contact.
The next speaker is Delilah Pulido. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
There are high-risk workers working throughout the county, but you don't want to allow your own employees back to their positions. Why do these workers need to be accommodated in another position? Why can't they return to their jobs? You have us testing regularly and wearing special PPE, implying we carry contagious disease because we are unvaccinated. What proof do you have? Is there a doctor that tested all of us and signed under penalty and perjury that we're walking around carrying COVID? You make outrageous claims without any evidence. If our God-given immunity didn't work, we wouldn't be here. The narrative is crumbling. There is a lot of data on natural immunity and proof that the unvaccinated are equal to the vaccinated. Why aren't you accepting that data? This is unacceptable to continue with the discriminatory risk tier system. There needs to be trust and transparency. Regardless of how you feel towards the unvaccinated, you should be very concerned with the level of corruption going on. I'm sure many of you have gotten COVID, just like all those politicians like Pelosi getting COVID. So let me understand this correctly. It's okay for you guys to get COVID and you don't lose your job over it, right? We know that both the vaccinated.
The next speaker is Ephraim. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Thank you, sir. Appreciate it. I agree with everybody else. I think you guys are acting like this is still the early stages of the pandemic. The numbers are out. The CDC already admitted that they do not have any count for anybody dying from COVID. They've lumped it up into everything. We had averaged about 6,500 deaths from the flu alone in California. If you look at the numbers now, nobody died from the flu in California. These are complete lies. You guys know what to do. You have to drop these vaccines because you have no scientific evidence to balance it. The vaccine came way too soon. Our bodies are designed to fight viruses. We develop antigens that protect us with all variants once we get the vaccine. With you guys enforcing a vaccine that only is spike specific, you're only handling 2 antigens and not the full variants. Natural immunity is the way to go. Why are you denying this? You need to answer that question. Why are you denying natural immunity?
The next speaker is Suzanne. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, this is Suzanne Nichols. I'm a nurse at Valley on unpaid, very clear unpaid. It sounded like Jeff Smith said paid when he made his statement. Also, I want to verify accommodations are not being done. I ask you, the Board of Supervisors, to request the names of people who have been accommodated, because I know of no one who has been in any way accommodated. For instance, when I was working before I was placed on leave, one of my jobs was 32 hours a pay period, calling people who'd been in the ED for abnormal labs and their COVID results as one of them. I did that from home, not front facing, not in a high risk area. And yet I haven't been allowed to do that as an accommodation to this procedure. So they're not trying to make accommodations. There's no accommodations. And to say that letting someone have no pay is an accommodation is ridiculous. That's on the face of it, ridiculous.
The next speaker is M. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
I agree with all the previous speakers stating that unpaid leave should not be considered reasonable accommodation. People's livelihoods and their families are being destroyed. People aren't able to put food on the table or pay for their rent. In a study from Singapore among healthcare workers with a history of headaches who wore PPE, such as face masks, for more than 4 hours per day, these healthcare workers either agreed or strongly agreed that the increased PPE usage had affected the control of their background headaches, which affected their level of work performance. This impaired work performance is identified to affect the work performance of 9 out of 10 with headaches and 42 out of 158 participants, which is 27%. I desire to have clear thinking medical personnel treating my family, and you should too. Thank you.
The next speaker is Ruth C. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. And Ruth, are you there? I will go to the...
Hello?
Oh, there she
Hello?
is. Go right ahead.
Hi, my name is Ruth Cervantes and I'm an ER nurse. I am vaccinated and I was mandated to get boosted. Since the beginning of the pandemic, we worked day in and out with very sick people who were in need of our care. Alongside fellow healthcare workers, we suited up with the PPE that was hospital provided and took care of people who we presumed had COVID. We rapidly ran out of PPE and were asked to reuse our N95 and surgical masks and shields with the patients. for weeks and even months. Meanwhile, the rest of the county officials stayed in the safety of their homes and remained there. So do I feel safe working next to unvaccinated staff? Of course I do. Do I feel safe taking care of unvaccinated patients? Of course I do. This order is not up to the state. We need to get on the same page. I'm afraid of the continued lack of support from our leaders and our county executives. As you can hear, none of them have been given reasonable accommodations. They're unpaid.
The next speaker is Christina Lopez. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Christina Lopez. Please investigate the risk tier system. Please let me understand why receptionist, somebody that doesn't touch another person, is a high risk and on unpaid leave without medical coverage. It's not fair to your employees. We're not touching other people. This risk tier system doesn't work. You're not investigating it. There's no paper documentation. Employees are suffering and they need to get back to work to protect their family, to have health insurance for their family. This is very wrong. Jeff Smith made me wear an N95 mask that affected my breathing. This isn't right what you guys are doing to your employees. Please stop him.
The next speaker is Jimmy. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. And Jimmy, are you there? I will. Oh, there you are.
Hi, yeah,
Go right
this
ahead.
is Jimmy. Sorry
Yes.
about that. My name is Jimmy Lopez. I work in the ED as a nurse. And I just want to point out that when I'm vaccinated, boosted, and I got sick. So I was super infectious. My symptoms were okay, but you know, they told me to go home. So how are we protecting our patients when I'm getting sick and I can infect them? I don't get it. I don't understand it. So how are we keeping our unvaccinated coworkers out when it's not even stopping me, who's vaccinated, from spreading coronavirus to our population, which is at risk already? That's what I don't understand.
The next speaker is Christina. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, thanks so much for hearing me again. My name's Christina. I work in the ER at VMC. So many of the jobs that are online are due to having religious exemptions without proper accommodations in the units that we worked in. And Jeff Smith said that, you know, they were getting accommodated, but not everyone is getting reasonably accommodated. Not one manager has approached the staff, vice versa, to let us work in the units in positions with less patient contact, such as callback nurse, such as what Suzanne said earlier, ADT nurse, charge nurse, or triage nurse. Santa Clara County has set an example of overcoming obstacles faced in the pandemic. Now it's your time, Board of Supervisors, to ask the right questions regarding this discriminatory tier system and finding the actual truth versus what is being said. Be a county that sets the example locally and nationally, that respects those with approved exemptions, and let us work and continue to work and serve the community and that we have always wanted to do. So thank you for your time.
The next speaker is Nadia. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, can you hear me?
Yeah, go ahead.
Hi, my name is Nadia, and I'm also one of the employees that would place on unpaid administrative leave. They are not paying me, it's unpaid. I've been out since December 7th. I don't understand how is that we are a threat to the public when we are the ones with our N95 testing twice a week, following all the protocols that they want us to do and still not letting us go back to work is just nonsense. It doesn't make any sense. If anything, we should be the ones concerned from our other employees who are not making them get tested as we are. I don't understand how can Mr. Smith get away with this by not letting us continue to work and serve our community, because that's what we do the best, and also not respecting our religious exemptions, which it is against the law. Thank you.
The next speaker is Rosie Moreno. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, so I'm just
reiterating what everyone said, but one thing that was really interesting was when Sarah Cody and the doctor spoke, and they said that 91%, I believe, of the county is vaccinated. So the question begs to differ if the unvaccinated are the ones that are truly affecting the county. The other thing that was mentioned was how the reasonable accommodations are we're supposed to get help. I thank Supervisor Ellenberg for bringing up that there needs to be consistency and transparency, because all of us who are on unpaid admin leave will be terminated as of June 22nd. So we urge you to get the 183 employees that would still have a job if the county didn't have a made-up risk tier assessment and would align with California state health orders. Everyone should keep their job. That's what I'm asking. Thank you so much.
The next speaker is Bren Perez. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Thank you so much for the opportunity. I just want to thank Supervisor Chavez and Vice President Ellenberg for standing up and asking the right questions. And we're so grateful for doing the right thing. When I had my exit interview with Assistant Sheriff, I asked, why couldn't we be placed in positions that we actually have in the jail today? We have people who have medical exemptions working there. And I was told because I would be required to respond to riots. These people in medical exemptions, they're not required to respond to riots. So it just doesn't make sense how Jeff Smith puts it on the department puts it on Jeff Smith. But I just wanted to really get the answer to what is the difference? What is the difference between me being unvaccinated and someone who is vaccinated? I want to know, what is the risk? What is the difference? That has not, please. I would like to know, because it makes no sense.
The next speaker is Ann Colton. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
In their journal dated May 1st, 2020, the CDC states, quote, proper use of face masks is essential because improper use might increase the risk for transmission. Thus, education on the proper use and disposal of used face masks, including hand hygiene, is also needed, unquote. The World Health Organization states using a mask incorrectly, however, may actually increase the risk of transmission rather than use it, unquote. The following is a 2009 list created by the World Health Organization as behavior that can increase transmission. Touching mouth and nose, touching a mask in use, touching a clean mask with unwashed hands, not washing hands every time after touching a dirty mask, wearing a mask that is not new and clean, continuing to wear a mask after it has become damp instead of immediately replacing it, reusing a single-use mask, not discarding a single-use mask immediately upon removal.
The next speaker is Alex Brunny. I am unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, first, thank you to Supervisors Chavez and Ellenberg for your efforts today. I would like to speak to the unpaid reasonable accommodation. Another point to remember is that the EEOC and many federal courts have taken the position that an indefinite leave of absence with no reasonable estimate of when the employee can return to work is considered an undue hardship. Making unpaid leave even more confounding for employers is the fact that the federal appellate courts do not agree on the standard to be applied to unpaid leave. The U.S. Seventh Circuit Court of Appeals, with jurisdiction over Illinois, Indiana, and Wisconsin, upheld last December 2020 in its decision that a multi-month non-family and medical leave of absence is not a reasonable accommodation under the ADA. The court said that this is because an extended leave of absence does not give a disabled employee the means to work. Instead, it excuses the employee from working, which the Seventh Circuit ruled is not an alternative contained in the ADA. Thank you.
And that concludes our request to speak.
Thank you. And I don't believe we had a motion on this item. So we'll consider this report from Dr. Smith received.
And with that, this meeting room will be closed. Thank you all for attending.